Now Cincinnati Connection, connecting you to your community.
Hey there, welcome to another edition of Cincinnati Connection. I'm your host, Sharice Gibson. Some major changes on the medical marijuana front in Ohio after the Medical Marijuana Advisory Committee said there should be some additional ailments or disorders listed in order to receive medical marijuana. So as it stands right now, in order to be a medical marijuana recipient, you must have at least one condition on the qualifying conditions list. Now, these are the conditions like HIV/AIDS, cancer, Crohn's disease, or ALS. But the Medical Marijuana Advisory Committee recommended that 5 other conditions, most of them relative to mental health, be added to that list. They are on your screen, making marijuana available to those suffering from them. Those conditions include anxiety, autism, depression, insomnia, and addiction. Now, if those proposed conditions are added, the number of Ohioans eligible for medical marijuana cards will nearly double, adding an additional 3.17 million people. Joining us from over the phone from Columbus is Robert Bridges, who is on the Medical Marijuana Advisory Committee here in Ohio. And we have in studio with us Dr. Maria Espinola, an assistant professor of clinical psychiatry over at UC Health. Thank you so much for joining us.
Thank you.
Robert, do I have you on the phone here?
Yes.
Okay, well, I want to go ahead and just start with you, Robert. Let's just talk about why the committee made these suggestions. Why these particular ailments do we believe that medical marijuana can assist with anxiety and depression and autism? Well, what research goes behind this?
This is what has come forth up out of the community of patients that use medical marijuana or have been self-medicating. And they have said that this works for these ailments. Can we get these added? And so, I really dislike bureaucracy being involved in this process because I really feel doctors should be doctors and recommend what they need to recommend for their patients. However, but we do have this law, so we need to expand it as much as possible. And here's the number one reason. The federal government recognizes over 400 ailments and conditions that medical cannabis can be used for. Ohio is limiting itself to 21. No. There's a lot more people that could be helped with this plan.
Well, tell me this. I know that there was a vote that the committee is expected to take up. Has that vote been taken just yet? And are we expecting this to pass? What's the overall kind of synopsis of this? Are people feeling like these are a few conditions that will be added on and assist 3.17 million more people?
I believe just my knee-jerk reaction from the rumblings I heard from yesterday, probably 4 out of 5 will breeze through with no problem. There is some hesitation on the opiate part where some doctors are skeptical whether or not medical cannabis can help with opiate withdrawal. So I'll let doctors be doctors and do what they do and discuss that. But from the patient side of the house, if it works for one person, let's do it.
Gotcha. Well, Dr. Espinola, I want to ask you and get your feedback on this one. Anxiety, depression, insomnia, these are things that are kind of in your realm here. Yes. Do we believe that reaching out or having people have access to medical marijuana will assist in having those conditions or assist with those conditions?
So I think it's really important to conduct research on this. So I'm definitely supportive of more research on this area, but currently I don't see enough evidence to support the idea that marijuana will be effective to treat these conditions. Not only that, but what I would like to see eventually is to see that marijuana is more effective than what we currently have. Because we have very effective treatments that we are currently using, and they're working very well.
Okay, well tell us this. Outside of that, some people feel like some of the treatments are not working. What is it that they can do, maybe possibly at home? What is a more holistic approach to anxiety and to depression?
Yeah, I think, so I love that, holistic, right? So you want to look at everything that is going on in a person's life. So at the beginning, when a person comes to me, specifically for anxiety, a very common disorder, people come stressed stress over so many things that they have to deal with every day, right? Childcare, work, unemployment, studies. So the first thing I tell them is like, the idea with therapy is not to reduce your stress to zero. That is not the goal, okay? So stress is part of life. It comes with being alive and dealing with all these stressors that we have to face every day. The idea is more about regulating the stress. Because if you were to get to zero, that means you have zero stress over what is happening with your children, how to pay the bills. So there is actually a certain amount of stress that is helpful to get you motivated and to get things done. So when I think of stress, what I work with my patients on is like, tell me from 0 to 10, how high is your stress? So 0 will be no stress at all. 10 will be you're so stressed, you're ready to do something very harmful to yourself or other people. Okay, so if your stress is between 0 and 3 every day, that's normal, that's expected.
Yeah.
But if it's constantly higher than that, then we may be having a problem here. We look at something that we call the baseline level of stress. So this is some people who say like, I wake up and I'm already at a 7. So anything that happens that day will get you to a 10, and that is very dangerous.
So, I mean, I want to ask you this, Robert, if I still have you on the phone with us. I mean, you have been an advocate for those who use medical marijuana. If we see these conditions added to that list of 21, does this kind of set a precedence for the future? Will we eventually see this list climb higher and higher and higher with your recommendation?
I believe so. This is the first time that the medical board has done this process, but as I've stated to other people in the past, we're not going to reverse from this point in Ohio. We've opened up Pandora's box, so to speak, and we only move forward from here. And as the doctor said, more research, is needed. Yes, but we need to have the mechanisms in place, the laws in place to let research happen. And we haven't had that because we've had, prohibition for the last 80 years.
Well, I mean, obviously this is a conversation that still needs to be had. Do you know, again, when that vote is expected to be taken up?
I believe it's June 12th.
Okay. So June 12th is the vote, when the vote will be taken up. And, Dr. Espinel, I want to ask you, I mean, once that vote is taken up and maybe they're given an opportunity to do more research, do you believe that we'll see more doctors involved with this process and learning a little bit more about how medical marijuana affects those with anxiety and depression?
We would love to learn more about that, yeah.
All right. Well, thank you so much for joining us. And thank you so much, Robert, for joining us on the phone over in Columbus.
Thank you.
All right. We'll be right back.